Oh my goodness. All right, welcome to another content episode. Today, we're gonna talk about congestive heart failure, right? We're gonna talk about right side, left side, signs and symptoms, treatment, digoxin, everything to the T. All right, listen, if you've watched those videos and you like them, I have one favor to ask. Please send this video to one of your friends because it will mean the world to me that we are passing this information from you to somebody else, because what we want is to help everybody pass their NCLEX on the very next attempt, right? And if you want more content, please go to the website, freengn.com. I have a lot of things over there where you can actually learn stuff, get value. I've got case study scenarios, I've got tests that you can practice, I've got content episode, just like this episode right here, right? So without further ado, I'm not trying to pitch you on stuff, but I want to give you as much value as I can so that I can help you figure this out, because there's no reason for you to not be prepared properly and go for your NCLEX and fail, all right? There's so many tools out there and we have everything under the sun to get you ready, prepared 100% to go and pass your NCLEX with so much confidence and zero test anxiety, all right? We teach all that and I want you to get so much value, all right? So without further ado, let me go ahead and start this presentation. I'm gonna share my screen here real quick. So we're gonna talk about congestive heart failure, all right? So those are my Instagram handles. And again, I'm on YouTube, I'm on Facebook. I'm not sure where you're watching this. Please follow me everywhere because I got so much value for you, right? And if you want to attend any of my free classes, all right, to talk about our programs for free, all you have to do is just text me on my personal number, 407-756-7139, all right? All you have to do is just text me Blueprint. And then I will sign you up to a free class where we're gonna show you the blueprint of how to pass your NCLEX on your very next attempt, all right? Now, let's go ahead and talk about this presentation, congestive heart failure, all right? So what is it? A brief, simple fifth grader definition of congestive heart failure, all right? So it's the inability of the heart to pump enough blood to meet the tissue's oxygen demand, right? So you've got the heart and you've got other organs. Those other organs, they feed off the nutrients in the blood. So how is the nutrients delivered? FedEx, right? Maybe you don't like FedEx, it's too expensive, right? But let's say FedEx. FedEx transfer all those nutrients to the organs, right? But then you've got the heart, and the heart is the FedEx office. It has to pump all those deliveries to the trucks so that they can deliver. If this office cannot pump all those trucks or like fuel all those trucks to go, I mean, I'm just coming up with this analogy, it's just on the fly, right? But if that office cannot pump all those trucks with fuel so that they go to the organs and deliver those nutrients, then the body's gonna die, right? So this office have failed, right? I don't know this analogy. I don't know that I should keep this in, but I'm gonna keep it in, all right? So listen, when the heart fails to deliver nutrients and oxygen to the organs, that means this heart is failing, right? So we've got right side heart failure, we've got left side heart failure. We're gonna talk about both and we're gonna talk about the signs and symptoms, all right? So signs and symptoms of left-sided heart failure. The left ventricle is the main pump of the heart. It's the bigger pump, it has bigger muscle, and it has a huge force where it can push all over the body, right? Now, that's why we call the left ventricle, when it pumps blood, we call it pumps blood to the grand circulation, which means like all the body, all the organs. And then with the right ventricle, it pumps blood to the petite circulation, which is the lungs, because it sends the blood to the lungs so that they can throw out the carbon dioxide, pick up oxygen, and then get back to the heart, to the left ventricle, where the left ventricle is gonna push everything to the organs, all right? All right, let's go ahead. Left-sided heart failure. So first sign, pulmonary edema, right? Left ventricular failure. Why? Because the blood is backed up. The left ventricle is not able to pump blood properly to the rest of the body. So what happens, that blood is gonna go back. It's gonna reverse back to where it came from, and it's gonna go to the lungs. And then the lungs, those alveoli cannot hold it. And then you gotta have pulmonary edema in the lungs, right? So when you put your stethoscope on a patient with left ventricular heart failure, what are you gonna hear? You're gonna hear S3 sound. The S3 sound means pulmonary edema, right? So it results in pulmonary congestions due to the inability of the left ventricle to pump blood to the periphery. Right, now the symptoms that you're gonna see dyspnea. Pulmonary edema, of course, the patient's gonna have dyspnea. Orthopnea. Orthopnea is when the patient is laying flat, supine, and then they have difficulty breathing, right? Patients with congestive heart failure cannot lay flat. They're always semi-fowler position, 30 degrees, 45 degrees, and sometimes even higher, right? So those patients will have orthopnea, wet lung sounds, which means crackles on the lungs. So when you hear the lungs, they're wet, you hear crackles. Cough, fatigue, tachycardia, which is high heart rate, anxiety, restlessness, and confusion, right? Now, when it comes to right-sided heart failure, peripheral edema, right? Remember, left-sided heart failure, pulmonary edema, because the blood is backing up from the left ventricle back to the lungs, right? Now, with the right ventricle, the blood is backing up. Right ventricle, the blood is backing up where? To the superior inferior vena cava, which is the peripheral extremities, right? So hands and feet are gonna get edematous. So that's why it causes peripheral edema. So that's the first sign of right-sided heart failure is peripheral edema. Results in peripheral congestion due to the inability of the right ventricle to pump blood out to the lungs. Often results from left-sided heart failure. Those are the causes of right-sided heart failure. So it starts with left-sided heart failure and then boom, after a few years, you'll have a right-sided heart failure, or you can have a pulmonary disease like COPD patients. They develop right-sided heart failure, or pulmonary fibrosis or any other lung disease can cause right-sided heart failure, right? Now the symptoms, as we said, peripheral edema for sure, weight gain, you got distended neck veins because the blood is backing up, right? So the blood is backing up. Inferior vena cava, superior vena cava. The superior vena cava is gonna go up to the jugulars, right? So distended neck veins, you got anorexia, you got nausea, you got nocturia, which is going to the bathroom at night, right? And then you've got weakness, you've got hepatomegaly, which is enlargement of the liver, and you've got ascites, which is accumulation of fluid in the peritoneum, right? In the abdomen. Just like those liver cirrhosis patient where you see their abdomen is super big because it's filled with water, and then you have to do abdominal tap to release all that water from the abdomen, right? So that's ascites, right? And usually you treat ascites also by giving IV albumin to the patient. It sucks all that the fluids back into the circulation. All right, now, when it comes to nursing care, you've got to monitor vital signs. Anytime you have a SADC question and then you've got vital signs, choose that option. Like it's almost every single time that is a correct answer, especially with matrix questions, SADC questions, vital signs. You'll never go wrong with vital signs, all right? Monitor apical heart rate. What does apical heart rate means, right? You're gonna take blood pressure, you're gonna take temperature, and you're gonna take your pulse, right? Maybe a radial pulse, maybe just on the Dynamap. But also, you gotta take the apical heart rate, where you're gonna put your stethoscope on the fifth intercostal space, like right on the apex of the heart, and you're gonna listen to the heart for a full minute to see what is the heart rate. And that is very important because if you're gonna give the digoxin to a patient, it's not just peripheral heart rate, you gotta listen to the apical heart rate, right? That's a question on NCLEX. All right, so monitor apical heart rate with vital signs to detect dysrhythmias, S3 sound, S4 sound. I told you S3 sound for pulmonary edema, you hear it with left-sided heart failure. S4 sound, on the other hand, is also called atrial gallop, and that indicates increased resistance in the ventricular filling, which is more, you see in left-sided heart failure, and it indicates aortic stenosis, right? Aortic stenosis, that aorta that goes from the left ventricle, it is stenotic. That's why you hear that S4 sound, right? Now, easy way to listen to S1, S2, S3, and S4, you just go to YouTube and type heart sounds, and then boom, you can watch a 1 minute video where you can listen to all the sounds and differentiate between S1, S2, or that are normal heart sounds, and then S3 and S4, they will show you in, it's amazing video. Like once you listen to it once, it will stick in your head forever. Number 3, assess for hypoxia, all right? Hypoxia, signs of hypoxia, when the oxygen saturation drops down in your pulse oximetry. What are the signs that you're gonna see? Of course, restlessness, where you see the patient, they're on the edge of their chair, they're like so anxious, trying to breathe. That's restlessness, all right? Tachycardia, angina, which is chest pain, all right? So we got stable angina, unstable angina, but we're not talking about myocardial infarction on this episode. That's another episode, so go ahead and watch it where we talk about myocardial infarction, right? It starts with angina, unstable angina, ST elevation MI, non-ST elevation MI, and different other arrhythmias that we talk about, all right? So angina is chest pain, basically. Number 4, auscultate lungs for indication of pulmonary edema, wet sounds or crackles you're gonna hear on your stethoscope. Administer oxygen as needed. Number 6, elevate the head of the bed to assist with breathing, usually semi-fetal position. Number 7, observe for signs of edema, right? Weight gain, so you weigh the patient on a daily basis. Monitor intake and output, so you wanna make sure that it's balanced. Measure abdominal girth because of the ascites, so you need to measure abdominal girth. And observe ankles and fingers, especially if the patient is wearing a wedding band. They will feel, oh my God, like I cannot wear it anymore because it's so tight. Number 8, limit sodium intake, all right? Sodium intake should be limited to 4 grams per 24 hours. Elevate lower extremities while sitting down so that all that edema is drained back into the great veins. And then you've got number 10, check apical heart rate prior to administration of digitalis, which is digoxin. I'm gonna tell you about it in a second. Withhold medication and call your physician if the heart rate is less than 60. Also, we're gonna talk about it when we talk about digoxin. Administer diuretics in the morning if possible. So if you've got a patient who has congestive heart failure, especially if it's the left side, and they're having peripheral edema and the physician put them on furosemide, for example, about 40 milligrams daily, right? You don't wanna give that furosemide at night or in the afternoon, because the patient during the night, they'll keep going to the bathroom every few hours and that will disrupt their sleep, right? The best time to give furosemide is when the patient is awake in the morning, right? So 8 in the morning with their breakfast, they take that furosemide, and during the day they will be emptying all that extra fluid that they have in their extremities, right, from the edema. Number 12, provide periods of rest after periods of activity. Of course, when you take a patient on a walk down the hallway, up the stairs, or in the hospital garden, or whatever it is, maybe the patient is at home and they go for a walk, you tell them you take periods of rest, because you don't want to feel that chest pain, you don't want that angina, right? So after periods of time, especially if they have portable pulse oximetry, when the oxygen saturation starts dropping a little bit, you need to tell them that they need to sit down and rest a little bit. So always rest between activities, all right? Now let's talk about digoxin indication. You give digoxin for heart failure patients to increase the contractility of the cardiac muscle, which is the left ventricle mainly, and slows the heart rate and conduction. That's why when certain arrhythmias, we give digoxin. Again, on the ECG video, we talk about that. But also you give digoxin for example, tachycardia, right? Because it controls the heart rate. Now also, that's why when your heart rate, the patient's heart rate is 60 or below, then you hold digoxin, because you don't want to drop that heart rate even more, and maybe you can get into arrhythmias of heart blocks, all right? We don't want heart blocks. All right, so side effects, severe AV block, right? You got type 1, type 2, Mobitz 1, Mobitz 2, you got third degree AV block. We don't want any of that chaos happening with the patient. That's why you need to keep a close eye on the heart rate, always epical heart rate, and the symptoms that the patient is having, right? Headache. So also those are signs of digoxin toxicity, right? So digoxin level, which I'm gonna mention it here in a bit, digoxin levels should be, that's the therapeutic levels, should be between 0.5 and 2. Now, if you take digoxin level and it's 2.1, guess what? You're gonna see some of those symptoms. Like the window for toxicity is so small. So it's not that it has to be 3 for digoxin to be toxic. It could be 2.1, right? 2.05, and then that is toxic for the body, right? So it has a very narrow therapeutic range. So 0.5 to 2, and the toxicity is right after that, all right? And dysrhythmias, got nausea and vomiting, got blurred vision, yellow-green halos with toxicity. They will see yellow-green halos right there, like when they're looking in their vision. Hypotension, low blood pressure, and fatigue, all right? Now, what is the nursing care for patients who are on digoxin? Monitors serum electrolytes. So those patients are prone to have hypokalemia, low potassium, increased risk for digoxin toxicity, all right? So anytime the patient has low potassium, the risk for digoxin toxicity goes up. Monitor serum digitalis levels if any side effects is present. So anytime you see any of those side effects, what you're gonna do, boom, let's take digoxin level. Check apical pulse prior to administration. Call provider if the heart rate is less than 60. And listen, equal or less than 60. Now, sometimes some of my students would come and say, hey Mo, if it is 60, what would I do? If it is 61, what would I do? And I'm like, listen, if your grandma is in the hospital and the nurse came in and checked the epical heart rate and it's 61, right? And she's about to give her digoxin, what would you do? You're like, hey, stop, like it's 61, like it's like really borderline, right? It's like 61. Like if you could digoxin, it might drop to 55. It might get, a heart block. Please, can you check with the provider before you give her the tablet? Like, I'm okay with you giving her the tablet, but can you please double check with the provider, right? You would say that. I would say that if it was my grandma, right? So you do the same thing on the NCLEX. So again, the NCLEX, people like the NCLEX, they're not there to confuse you. They're not there to play tricks on you. Even though there are tricks and traps on the NCLEX, you need to be aware of, right? But if they give you 61, hold that dose, please. Can you hold that dose? Can you hold that dose, right? Can you hold that dose? Yes, please hold that dose. Like, call provider. This is what I would do if my grandma was in the hospital. I'll hold that dose, call the provider. That's clinical judgment. That's critical thinking in a case study, all right? Okay, awesome. So, and again, on the NCLEX, they're not gonna give you super narrow. They might give you 60, 58, which you should hold the dose. And they might say apical pulse is 65, which is okay. You go ahead and give the dose, all right? Now, number 4, teach patient to take radial pulse prior to administration. If the patient is at home, they're not gonna take apical pulse, right? They take radial pulse and before they take their digoxin medication. And then therapeutic range is 0.5 to 2 milligrams, right? Now, antidote, because if you see any side effects of toxicity, what are you gonna do? You're not gonna sit there and watch the patient. What you wanna do, you wanna give an antidote, right? And digoxin, thank God, has an antidote, which is digoxin immune fab, right? So antidote for digitalis toxicity, that's the indication, and it also binds to digoxin to prevent binding at the site of action and will not allow it to do what it's supposed to do, right? So side effects, it decreases cardiac output and it causes atrial tachydysrhythmias or atrial arrhythmias, tachyarrhythmias, which are atrial fibrillation, atrial flutter, right? Now, nursing care when a patient is taking the antidote is you place the patient on a continuous cardiac monitor, because if any of those atrial tachyarrhythmias happen, you need to see them right away, because the algorithm for those, and again, we talk about it on the ECG video, when you see those tachyarrhythmias, you have to treat them within 48 hours. That's the algorithm. After 48 hours, the algorithm changes and it's gonna be more chaotic, right? Now, in nursing care also, you should have resuscitation equipment at the bedside before giving the first dose, because God forbid, anything happens, tachyarrhythmia develops into a ventricular arrhythmia or heart block or whatever the case might be, you need to have a crash cart ready to intervene, all right? So listen, I hope you enjoyed this video. This is the presentation that I had for you for congestive heart failure. I hope you enjoyed it. If you did, please send this video to a friend of yours. It will mean the world to me if you spread the word. And do not forget, follow me on social media. And if you want more, go to the website freengn.com. I have a lot of case study scenarios. I have a lot of content episodes, tests that you can practice. And if you have any questions at all, please do not hesitate. I gave you my personal number. Again, 407-756-7139. All you have to do is just text me. If you failed before and you want me to break down your candidate performance report, I'll do it for free. Just go ahead and text me, love your face, and I can't wait for you to pass your NCLEX, and then text me and say, oh my God, Mo, I passed my NCLEX. Listen, that's the best feeling in the world. Just in the last 2 years, we've helped 27,000 students pass the NCLEX, and I'm 100% sure that we can help you, because we have 100% passing rate in 13 states around the country, 99.2% in the United States and Canada. It's insane, all right? We have cracked the code, and I can give you the blueprint, all right? But we gotta hear from you, all right? Love your face. Can't wait to see you on another content video. Let's go.